Okay, let's dive right into a critical medical puzzle. Imagine you're in an emergency situation and a patient's entire system seems to be going off the rails. Today, we're going to unpack the causes of a really dangerous condition called acute respiratory acidosis. You know, our bodies are constantly performing this incredible chemical balancing act to keep everything running smoothly. But what happens when that balance gets thrown way off, just by the simple act of breathing? So, you're looking at a patient's lab results, and the numbers are practically screaming at you. Carbon dioxide is climbing, and the pH is dropping fast, making the blood acidic. That CO2 is building up, mixing with water, and boom, creating carbonic acid. So, what on earth is going on here? Well, what you're seeing is acute respiratory acidosis. But forget that big technical name for a second. Look closely at the definition. There is one single word in there that is the absolute key to understanding everything else. That word, hypoventilation. Seriously, this is the master key to the whole thing. If you can really wrap your head around what hypoventilation is, you'll understand the root cause of this entire condition. It sounds kind of complicated, doesn't it? But really, hypoventilation just means under-breathing. That's it. The body simply isn't breathing enough to clear out the carbon dioxide it's making. So that CO2 gets trapped, and that's when all the trouble really begins. Okay, so if underbreathing is the problem, the obvious next question is, why? What's actually causing it? Well, we can break down the reasons into four main culprits. Let's walk through these four categories so you can really see how this happens. So here are the four big groups at a glance. You could have a problem with the brain's command center, an issue with the muscles that actually do the breathing, a roadblock in the airways, or just a mechanical problem with the chest and lungs themselves. Let's break them down one by one. First up, culprit number one, central nervous system depression. Think of your brainstem as mission control for breathing. It's supposed to be on autopilot. But what happens if something slows down mission control? Things like opioids, sedatives, or a head injury, they can all do that. The signal to breathe just gets weak, kind of lazy. The body literally forgets to breathe enough. And the result is, of course, hypoventilation. All right, let's move on to culprit number two, neuromuscular weakness. Now, in this case, mission control is working just fine. The brain is yelling, breathe, but the message is getting lost somewhere, or the muscles just can't carry out the order. It's like a general shouting commands, but the soldiers on the front line, your diaphragm and chest muscles, are too weak to respond. This is what you see in conditions like Guillain-Barré or a high spinal cord injury. The command is sent, but there's no response. With our third culprit, airway obstruction, the brain and the muscles are working perfectly, but the problem is basically a giant traffic jam inside the lungs. During a severe asthma attack or a COPD flare-up, the airways get so narrow that CO2 just can't get out. The patient is trying to breathe, but the exit is completely blocked. And our final culprit has to do with the physical mechanics of breathing. Your lungs and chest are kind of like a bellows, right? They expand to pull air in and shrink to push it out. But what if that bellows is broken or something is squeezing it shut? A collapsed lung, which is a pneumothorax, or even external pressure from something like severe obesity or a curved spine can physically stop the chest from expanding. It's a structural problem that leads to, yep, you guessed it, hypoventilation. So we have those four main causes, but there's also a special, really high-stakes situation that we often see in critical care. And this one is a bit of a paradox. The very machine that's designed to help someone breathe, a ventilator, can actually cause respiratory acidosis. It's kind of wild. If the ventilator settings are too low for what that specific patient needs, the machine itself ends up causing the hypoventilation. So we've looked at the brain, nerves, muscles, airways, even the machines we use to help. They all seem like totally different problems, don't they? But there is one powerful single thread that ties every single one of them together. And here it is, the big takeaway. It doesn't matter why a person is underbreathing. It could be a drug, a disease, an injury, a machine, whatever. If the end result is that the body can't clear out enough carbon dioxide, you are going to get acute respiratory acidosis. It all comes back to that one single mechanism. So if you only remember one word from this whole explainer, please make it this one: hypoventilation. It is the single root cause behind all the clinical chaos of acute respiratory acidosis.